you're in the right place. You already know this webinar is the conclusion of a joint project through which the 3 Sussex Carers Centres were commissioned by the Sussex CCGs to explore carers' experiences of healthcare. The format today is that we'll be opening with 2 presentations. It's not going to be death by PowerPoint. So we've got 2 presentations. The first is a foreword from the NHS, and the second will share our findings, or a summary of our findings from this project, and really what we heard from carers during our research. Then we'll move on to a plenary session where we'll invite questions for the panel in relation to carers' experiences of healthcare. And finally, we'll wrap up with closing remarks and next steps. We will be keeping an eye on the chat when it opens for the plenary session for questions to put to the panel. So feel free to make use of it to give your views and to and as you listen to the initial speakers, start thinking about any questions that you would like to put to the panel. So without further ado, let's get on with hearing from some of our speakers. So our first speaker is Samantha Allen, the Chief Executive at Sussex Partnership NHS Foundation Trust, and we're delighted to open our session today with a word from Sam. So over to you.
Thanks very much, Joan. Good afternoon, everybody. And it is truly a privilege just to have the honour of saying a few words at the start of this session. From a personal lived experience perspective, I feel very connected to and passionate about the very, very important role that carers play in our society, in our communities. So thank you very much. And whilst I'm going to be saying a few words just to open up, I'm going to be with you for the whole afternoon and very much in listening mode. So as Jo said, I'm the Chief Executive of Sussex Partnership, NHS Foundation Trust, and we're the organisation that provides most of the mental health and learning disability services across Sussex. I'm really pleased that we've got really good, strong partnerships with the carer support organisations across Sussex and the work that we do as a trust on Triangle of Care. But as Jo said, I've been asked to say a few words to the NHS. So I wanted to, I suppose, share with you some of my reflections on the past year and also on the very important contribution that carers make. I think the first thing I want to say, and it's particularly poignant given yesterday was the National Day of Reflection, marking the anniversary of 1 year since lockdown, is that it's been a really, really tough year. And I think everybody's had their own unique experience of the past year, but it's been an incredibly tough year for carers and those caring. And I think there's really important research and paper that plays back to us the very lived experience of carers across Sussex is incredibly important. But of course, I'm sure many of you would say it was tough the year before and the year before that. If there's one thing this pandemic has been, it's been to some extent a levelling of our appreciation of life and humanity. However, depending on where you sit, depending on your role in the community, either as a carer and an unpaid carer at that, but also depending on your employment status, where you are at your time in life, either a children young person or somebody who's an older adult, the challenges, I think, have been similar on the one hand and different on the other. So certainly over the last year, we know that isolation has been exacerbated. If we think about before the pandemic, there was 6.5 million, I think Carers UK reported back in 2018, 6.5 million reported people in caring, unpaid caring roles. It's thought over the pandemic, over the past year, that's more than doubled to just under 14 million people undertaking a caring role. We also know, and I know this again personally as the chair of the Health and Care Women Leaders Network for the NHS, women do a significant amount of caring. It's about 58% when we look at the gender split on caring. And equally, with schools being out this year and coping with all of the additional responsibilities that has brought around homeschooling, again, that has added to the burden and the expectations placed on those in caring roles. And if we think about the mental health impact on carers, again, pre the pandemic, if you identified as a carer, Carers UK would say about nearly 80% of carers identified mental health difficulties. And yet we know from some other research that we've undertaken, even just looking at the workforce, the NHS workforce and the caring workforce over the past year, both the physical and the emotional tolls during the pandemic have been absolutely exacerbated, as have the amount of hours people are doing unpaid caring roles has increased. So I think this year, I think if I was to say from an NHS perspective, there was certainly a lot to do to support both the identification of carers out there, the support to carers, providing the space to listen to carers before the pandemic. I think this year has really highlighted actually not just the urgency of doing more, but actually it's exacerbated a whole number of issues that carers certainly have experienced. And I think, you know, particularly around how we protect mental well-being proactively with a sort of more preventative approach, how people navigate services at times when access to service may have been limited, restricted, or digitally available. And we think about digital inclusion and exclusion being a particular issue. If we think about access to food, medication, and indeed, whilst the vaccination programme gives us tremendous hope, and that is making really good progress across Sussex and of course nationally, it is another minefield of which one has to navigate as a carer of somebody. And of course, there's staying active and well during this period. So I talk to people who tell me they've had the best year because they've been able to spend more time with family, they've been able to get a greater appreciation of the environment. But I also speak to people who are socially isolated, whose vulnerability has increased. And whilst we are just on the cusp of heading out of a second national lockdown, certainly in the services I'm responsible for, we're perhaps seeing some of our greatest demands come through. And I think it's still very early days for that. And we'll certainly be living the consequences of the pandemic for many months, many months, and indeed years, I suspect, to come. So whilst this year's been tough and the future is optimistic, particularly given the vaccinations, I think when it comes to carers and the NHS, we don't just need to be listening now to the research. We really need to be taking concerted, focused action right across all of our services. And indeed, I was really interested in one of the findings around what I saw as consistency as well. So why is it that you can have a really great experience in one service, and indeed I count my own organisation in this, and yet a really poor experience in another? So how do we make the identification, the support, and I think get the understanding using the research and evidence that carers need to be cared for too and need support. So from an NHS perspective, we're really committed with working and supporting the carers. Of course, those are fine words, and I'm sure many of you have heard those many times over many years. I do think we are making some positive progress in some areas, but like I said, we need to do more. It needs to be more consistent right across the board. And that includes things like how we share information across professionals. More often than not these days, I think when you're caring for somebody, they have multiple needs that don't fit into one box. And indeed, a carer supporting the person they're caring for, navigating healthcare services when they may be receiving care from multiple clinical teams in different settings and different places is indeed, of course, one of the huge daily challenges that I know many carers face. So I do think in terms of how we're working together across health and care, working closely with our local authority partners through the integrated care system, which is the Sussex Health and Care Partnership, whilst it still is early days, the intent is that we do work harder to join up care and support care across pathways. And again, on the mental health side, that includes integration with physical health care and vice versa. So Jo, I think the themes in the report are really clear. They're themes that I recognise, not just from what I've heard people talk about over the past year, but actually some of these themes are fairly long-standing, I would say, and perhaps have just been exacerbated through this COVID year. But I suppose the spirit for me is actually, as humans, as all recipients and people who invest in our National Health Service, and it is a National Health Service, it's there for the community and shaped by the community. I think it's really important that we certainly across healthcare, and I know our local authority partners do a tremendous amount of work for carers, be committed to do this too, that we do take the findings of this report really seriously, that it's not a report that gathers dust on a shelf, it's something that we can really utilise and draw on as we also as a health service are recovering from a difficult year and putting services, restoring some services, but also continuing to make changes from other services as well. So it's a real pleasure to be here with you this afternoon, and I really look forward to the conversations that we're going to have and listening to you report the findings of this and thinking through together how we can progress this area. Thank you.
So next up we have Steve Castellari from the Carers Centre for Brighton and Hove, and Adeelah Khan from Carers Support West Sussex, who it's been an absolute pleasure to work really closely with on this project over the past few months. So they're going to talk through our findings and the recommendations from the focus groups and the survey and the research that's taken place. So without further ado, I'm going to ask Adeelah, I think you're sharing your screen for the slides, aren't you? And then I'll hand over to you.
So hopefully everyone should be able to view the slides on screen. Yeah, perfect.
Yeah, I can see them.
So over the next 3 slides, I will be sharing a brief overview of the project background, the stages of the project, and who and how we engage with carers to gather their feedback and insights for the carer-led recommendations we are going to share with you all today. So the project has been commissioned by the Sussex Clinical Commissioning Groups, or CCG for short, and has been delivered as part of the Sussex Carers Partnership, which comprises of the Carers Centre for Brighton and Hove, Carers Support West Sussex, and Care for the Carers East Sussex. The project focused on healthcare during the COVID-19 pandemic, and unpaid family and friend carers' views were sought on their experiences of healthcare and what carer-informed and carer-led recommendations we could put forward to ensure that people are getting the care they need in a way that suits them. Therefore, the 3 main aims of the project were: number 1, seek the views of carers across Sussex regarding the challenges they are faced when accessing healthcare, including being recognised as carers. Number 2, establish if there are issues which may relate to a particular community or area of Sussex and differences compared to other areas and communities. Number 3, identify the priorities for carers regarding healthcare services, especially related to COVID-19 and the vaccination programme. As shown in this diagram, the research project comprised of 4 stages. Stage 1 was work that had already been completed by each of the 3 carer organisations, which occurred during 2020, where family and friends carers had been given the opportunity to have their say at various carer engagement initiatives of Pan-Sussex. This included the Carers Centre for Brighton and Hove conducting a survey following their Carers Festival Week in June 2020. Care for the Carers East Sussex hosting a Carers Voices conference in July 2020, and Carers Support West Sussex working in partnership with the West Sussex County Council commissioning team to review their charity strategy and the joint commitment to carers, which is still an ongoing project. Stage 2, which ran from November to mid-December 2020, was carrying out a detailed comparison of the Stage 1 findings to establish common themes and issues raised by each respective carer support organisation's engagement and consultation activities. Using that information, we moved on to Stage 3, which was additional research being conducted to further narrow down and establish what the main priorities were for carers around healthcare services following the lockdown restrictions. And then the last stage, stage 4, involves feedback on findings from today's webinar session, and any key points that are raised today will be included in the final report for this project, which we will be circulating and sharing with everyone once complete. So our engagement with carers across Sussex took place in the form of 3 discussion workshops, which were hosted at the start of the year. Based on the review of research from stages 1 and 2, 3 recurring themes were identified that were explored across the workshops. So workshop 1 was around planning for recovery, and carers were asked about what practical actions could health services take to meet carers' needs during the pandemic recovery period for this year and beyond. Workshop 2 explored carers' experiences of navigating healthcare systems. So the discussions focused on whether carers were being identified as expert partners in care and what steps could be taken by healthcare staff to make carers feel valued. And then workshop 3 focused on carer identification and making carers visible. So views were therefore sought around the stages of a carer's journey in accessing support and the barriers they may come across in being seen and supported as a carer. A total of 22 carers participated in the discussion workshops. We also undertook an online survey covering the same themes, including telephone surveys being carried out with at least 5 non-digitally engaged carers for each organisation. The online survey ran from mid-December to the end of January, with a total of 118 respondents taking part. So I'm now going to hand over to Steve, who will be talking you through the conclusions from our research findings. So over to you, Steve.
Thank you, Adeelah. Adeelah has set out the framework that we used when looking at this project. And my task now is to just briefly talk through the conclusions that we came up with. And then I'll hand back to Adeelah, who's going to look at the recommendations that we feel should be taken forward. So 2 slides of conclusions. The first conclusion really was around the difficulty of navigating healthcare services. Carers felt that successfully navigating services is difficult without a proactive approach from healthcare providers. A term that carers frequently cited was struggle or fight. And that relates to the access of care and support that they or the person that they're caring for need. Main services and options and the routes to them need to therefore be clear and obvious, not only for carers and the people they care for, but also for other healthcare professionals, so that the entire system knows the pathway that a carer will have to take. The second conclusion that we drew was around delayed or cancelled access to healthcare services. The ability to access healthcare services, especially with regards to delayed or cancelled appointments and services compared to spring 2020, was a major concern for carers we surveyed and spoke to in January. Carers frequently cited services being cut and the loss of regular checks and monitoring as a cause for concern. This issue affected both the person being cared for and the carer in many cases. More than 60% of carers responded that this was an issue for them across both the survey and the workshops. So it was obviously a very common theme. The third conclusion that we drew was around poor carer identification. The identification of carers and the recognition of carers' expertise by healthcare services was generally described and seen as haphazard or poor. It was felt that this has had a profoundly negative effect during the pandemic, with carers not being prioritised for vaccination, multiple journeys having to be made in the case of carers who help more than one person, and really a lack of joined up thinking relating to carers and the person that they are caring for. You may notice that a lot of these themes are things that Sam mentioned in her opening. The fourth conclusion, the final one on this particular page, is around the term carer itself. Carers we surveyed and spoke with were frequently unsure if they were listed as a carer at their GP practice. COVID-19 vaccination information, that is the when, the where, the how, and the for whom, is of huge importance to carers. And if they're not registered at the GP, or they don't know if they're registered, there could be confusion about when and how they actually get vaccinated. However, there were also issues around the use of the term carer for some. Some carers understood it to simply be a term that gave you access to services. So it's like a legal term. And generally there was an acceptance and a tolerance of the term carer when it's defined in that way. For some others, though, it was seen as almost a degradation, a reduction of their human relationship with them and with the person that they're helping. This was most strongly espoused by those with close familial ties. For example, parent-child relationship, or where it's a person is caring for a partner. Those are our first four conclusions. Adeelah is going to hit the button and move on to the next. Thank you. So our fifth conclusion is around carer contingency. Backup for carers and respite is critical. We know this from our stage 1 and stage 2 findings. Although backup plans are available to carers, the already limited respite options were reduced further during the pandemic. This is a long-standing issue which has been raised by carers many times previously. And the pandemic has raised the need for respite to critical levels. And it's particularly acute with those who have been shielding and/or are isolated from support because of COVID-19 restrictions. That leads into our next conclusion. This was the most common theme that came out across our research: the impact on carers' mental health. The negative impact of caring on mental health, and we include within that loneliness and isolation, was one of the single biggest issues expressed by carers during the research. In fact, 80% of respondents in the workshops cited this, and that's been a regular theme, I think, over a number of years. Previous research has shown this frequently to be an issue for carers because their normal way of living has to change to accommodate the care that they provide. Another factor that we had to consider is that there is also a stigma attached to mental health that is not found to the same level regarding physical health. And for some communities, this is even more prevalent. The pandemic has exacerbated mental health issues towards crisis levels for some carers. The last two conclusions are based around communication. The first is around confusing messaging about COVID-19. We asked who the most trusted sources of information were, and there were three that came up as the top sort of sources, but I'm going to pick on two of them. So COVID-19 messaging from NHS and government were ranked highest in terms of trust, but that was by no means universal. This messaging is around the actions that society and individuals should take to keep themselves and the people they care for safe. It includes messages about shielding, access to healthcare services, both COVID and in general, vaccinations, and the prevalence of the virus in particular areas of society. So I'm sure we can all appreciate the impact of that messaging being trusted by carers. That leads into our last conclusion, which is also communication based and is something that Sam mentioned in her opening. The inconsistency of communication. Communication between carers and healthcare providers was seen as inconsistent and leading to highly variable outcomes. Some healthcare providers were described as brilliant. They identify carers, they include carers in discussions about the care being provided or to be provided. This wasn't a universal view. Many carers felt that the service provided from one healthcare setting to another, and even within the same GP practice, trust, etc., was more dependent on the individual that you interacted with, rather than a standard that applied to everybody. Those were our conclusions, so 8 conclusions, and from those we then have highlighted some key recommendations, and I will hand back to Adeelah to just go through those with you.
Thank you, Steve. So on the screen now, we have a list of 6 carer-led recommendations because of this research project. Now, each recommendation we have discussed in more detail in the final report, which we hope all of you look forward to seeing and reading. But for the purposes of this presentation, we're just going to give a summary for each recommendation, which is being shared in no particular order, I should add as well. So recommendation 1 is to introduce incentives to identify carers. So it was identified that healthcare services are in a privileged position with regards to identifying and supporting carers, and by extension, the person that is receiving care. Therefore, a recommendation is to offer financial incentives for health services to ensure that carers are registered and that their views are also being sought through partnership working with carers through GP practices, patient participation groups, for example. Recommendation 2 calls for the introduction of mandatory carer awareness training, and this would be for all healthcare staff and would include the topics around identification, the use of the term carer and referral for carer support. And in order to reach as many healthcare staff as possible, a blended approach is recommended, which would involve online e-learning and face-to-face learning sessions, with the training being co-designed and or co-delivered with carers and utilising existing training resources and the involvement of local carer support organisations, which we realise would be dependent on local commissioning. Recommendation 3 was around a centralised carer record. So a medical records held, whether this is Sussex-wide or at a more local level, must have a requirement for a prominent carer field to be completed, even if this is to record that the person is not a carer, or in the case of a patient record, that no carer is involved. Unknown should not be an option, and completion of this carer field should be monitored. Recommendation 4 focuses on reducing the negative impacts on caring on mental health. As Steve obviously mentioned, 80% of our respondents highlighted this as a major issue. And given the current circumstances, there is a need to prioritise this recommendation perhaps, and calling on healthcare services to be more proactive in discussing with carers any issues and or the impacts of providing care, and where necessary, making onward referrals for mental health support. Mental health awareness training should also be mandatory for all healthcare staff, and relevant support services and resilience building workshops should be commissioned where they are not already available for carers. Recommendation 5 calls for regular and consistent messaging. So from the findings, as Steve has mentioned, we know that the trusted sources of information were any comms from the NHS, local GPs and the government. However, it is recommended that regular and consistent messaging is devised and delivered to carers regarding the COVID-19 vaccination programme and, of course, the continuation of non-COVID-19 services. If vaccination is likely to be an annual event similar to the flu jab, then careful consideration should be given to carers and the people they help in being vaccinated at the same time. This recommendation was felt to be achievable where accurate records of carer and the person they help are kept and updated. And lastly, recommendation 6 focuses on creating a roadmap for services and support. So recommendation to produce a clear, concise and accessible roadmap of major services and options for carer support. This can then be provided to all known carers, as well as new carers identified either by healthcare providers, carer support organisations, carer assessment workers, or other agencies in a position to offer this information, such as schools and libraries. So that's the end of what we wanted to present, and I will hand back over to Jo, who will be facilitating the discussions we hope to have about what we've presented to you all.
Right, thank you, Steve and Adeelah. That's really helpful. And I can see there's already some chat coming through, which is great, because it leads us nicely into the plenary session where we can kind of talk through those recommendations and the reactions to them. And our kind of agenda for today is to hand over to Jane for some closing thoughts really about next steps. And I know you said we've already kind of stolen your thunder and you shared some of that already, but let's just come to you, Jane, to think about how we take these recommendations forward.
Thank you, Jo. And goodness, how on earth do I sum up something like this? I think, first of all, thank you to the 3 carers organisations for such a fantastic piece of work. And thank you also to all the carers that participated. The quotes in there, the richness of the information is absolutely fantastic. So thanks to everybody. I think just saying and following on from others on the call, I'm actually a carer myself, and my carer journey was going along like this, and all of a sudden it's gone like that, which is disconcerting. So the discussions that have been had today are starting to really resonate with me now, and that's another reason why I'm really passionate about this. So I think going back to what Sam said, what we know is that there are, and I know from a long time of working in Brighton and Hove, is that we've done a lot of engagement with carers, and there have been issues come forward, but these have been really exacerbated by the pandemic, very much so, and that comes out loud and clear in this report. I think it's heartening to see that there are some areas of good practice, and I think going forward it's about understanding what makes them good, what was good about them, and building on that. So we're not starting from scratch, but recognising as well that many of the experiences are less than good, that need to be improved. So that's part of what we need to do going forward. So I think in terms of what next, as I said earlier, we are extending the funding for these organisations for this piece of work. And when I say this piece of work, as I say, it's hopefully we can progress the recommendations. I would suggest that part of next steps is a meeting or a discussion between myself, Gemma, Mark and Tamsin and the carers organisations to look at those recommendations and say, okay, what's in train already? Because there might be things that are happening. What more can we do? What's the piece of work we need to do for each one? How can we involve carers in that in a co-productive way? And there are a couple of other things to pick up, like the dejargonisation. No small task that as well. So really it's how do we take that forward? But I think you've heard from Sam about that commitment from herself as a chief executive and taking that to partners. I think you've got the absolute commitment of obviously the local authority commissioners that are here in the NHS to be able to recognise this, to give a pledge to be able to take it forward, to address the recommendations. And I think, as people have said, it's a point in time. There's been so much good work as a partnership about vaccination. Let's kind of seize that, jump in on the back of it and make sure that this is taken forward. And I think it was Gemma that said it's a mandate for change. When you get views and experiences, that's what we can hold up. It's not something that, I'm saying, I think this affects people in this way. We can hold up and say, people have told us, and this is where we need to improve. So an absolute pledge from Sam, as you've heard, from myself, from the local authority commissioners, to work with the carers organisations and carers to take this forward and really make some change. Thank you.
Thank you, Jane. Hugely appreciated. And I think the fact that actually, we're closing on a comment around sharing personal experience of caring. I was intending at this point to say to all the carers in the room, and I include the health and social care and voluntary sector professionals who are also carers in this. You know, if this session has shone a light or highlighted or triggered actually that moment of needing to access support for yourselves, remember there are carers organisations across the county which are absolutely there and funded to provide that support. So do get in touch and talk to us about what you need. Thank you to everyone who has taken part in the project, both all of you who are here today, but also a wider thanks to those carers who took part in the focus groups and the surveys, and obviously to the colleagues who we've jointly delivered the project with. It's hugely appreciated.